I wake up before the sun does. My alarm blares at 5:15 a.m., but I've been awake for 15 minutes already, staring at the ceiling. Coffee isn't an option yet. My stomach twists just thinking about the day ahead. I pull on my scrubs, the same faded blue ones I've been wearing for months. They smell faintly of antiseptic and yesterday's sweat. The drive to the hospital is quiet. Streetlights flicker past my car window. I watch the world sleep while I head into chaos. I try to breathe, try to brace myself, but it's never enough. The hospital lobby is already buzzing. Security guards nod at me like they understand. I pass the vending machines I never have time to use. The elevator ride feels longer than it is. I catch glimpses of other nurses. Some look exhausted. Some look furious. All of us pretending we're ready when we really just want a few more hours of sleep. The first patient of my shift is Mr. Thompson. He's 92 and has been in the hospital longer than I've been a nurse. He greets me with a raspy, "Good morning," though it's more of a whisper. I try to smile. I always try to smile. Blood pressure first. Pulse. Temperature. I jot notes in his chart while he complains about the food. "They gave me oatmeal again," he mutters. I nod. "Would you like me to see if they can switch it?" I ask. His eyes twinkle. "You always ask nicely," he says. I force a laugh. It's early, but he already makes me feel human. Next is the emergency room. It's a constant storm. Bleeding, broken bones, anxiety, and fear colliding in one tiny space. I scrub my hands for the third time in 20 minutes. My hands are raw, red, cracking at the knuckles. But there's no time to think about that. A young man comes in with a deep cut on his forearm. Panic grips him. I kneel to meet his eyes. "Hey, we're going to take care of you," I tell him, trying to keep my voice steady. His mother grips my arm. "I'm sorry," she keeps saying. I tell her there's nothing to apologize for. But I feel a pang of frustration. Not at her, but at the world that allows accidents to happen. Between patients, I run to the nurse's station. Charts, calls for lines to check, medications to administer. Each beep of the monitor is like a countdown to the next emergency. I laugh at some of the jokes my coworkers make. It's dark humor, the kind that makes outsiders uncomfortable. We cling to it because without it, we might cry right in the middle of triage. Lunch comes as a rumor. By lunch, I mean a granola bar shoved in my mouth while standing over a patient chart. I've learned to eat fast, to hydrate less than I should, to ignore the growl of my own stomach while tending to someone else's. The patients keep coming. Mrs. Patel, who refuses to take her pain medication because she doesn't want to feel sleepy. Mr. Jenkins, who keeps calling me by my sister's name. I try not to react. I've learned to separate the personal from the professional. Mostly, the hardest part isn't the cuts or the fevers or the IVs. It's watching people fall apart and knowing there's only so much you can do. I held a hand once as someone took their last breath. I wasn't ready. I never will be. But I did it anyway. Because someone has to. A code blue rings out. I sprint without thinking. My heart races. I focus on the steps, the equipment, the rhythm. I try not to notice the shaking in my legs. By the time we finish, the patient stabilizes. I step outside the room, take a shaky breath, and move on. The midday chaos is followed by a lull. I sit for 2 minutes on a bench in the hallway. 2 minutes is luxury. I glance at my phone. Messages from my friends. Some complaining about work. Some inviting me out. I smile weakly. I'm exhausted just thinking about leaving. The afternoon is a blur. Pediatric patients with fevers. Toddlers screaming, parents panicking. I reassure them, calm them down, check vitals, administer meds. Each child feels like they're my responsibility, but there's a constant fear. The fear of missing something. A change in color. A drop in temperature. A symptom that could spiral into disaster. Sometimes I have to deal with people who are rude. They yell at me for waiting too long. They complain that the hospital is too cold or the food is too bad. I nod and smile, because if I argue, I'll never finish my shift. And I've learned the truth. The world doesn't care that I'm tired. I walk down the hall and hear a quiet laugh. A patient just got a funny joke from their roommate. I pause. It's easy to forget these little moments. The smiles, the relief, the tiny victories. They make this job bearable. Somehow, then comes a night shift crescendo. Heart monitors beep like frantic messages. For pumps hiss. Patients call, cough, groan. I answer. Always. Even when my legs feel like lead. Even when my back aches. Even when I haven't seen a day without fluorescent lights in hours. A nurse's life is a mix of science and empathy, a dash of chaos, a splash of humor, and more patience than I thought I had. I administer medications, check vitals, update charts. I comfort families who can't sleep. I smile at patients who need reassurance. And I listen. I always listen. Some nights, I cry in the supply closet. I don't tell anyone. I breathe through it, wash my hands, and go back to the floor. No one asks why. No one notices. But it's real. There's a beauty in this life, too. A quiet triumph when a patient takes their first steps after surgery. A small smile from someone who's been in pain for days. A thank you whispered with genuine warmth. I finished the last rounds. Checked the charts one final time. My feet hurt. My back aches. My mind is foggy, but my heart is full. There's a weird pride in surviving the day, even when it sucks. As I finally clock out, the hallways feel different, quieter, almost peaceful. I walk to my car, lights flickering on the wet pavement. I think about tomorrow, and the day after, and the day after that. It's never easy. It's never predictable. But it's mine. I drive home under the stars. The world sleeps, but I think about the lives I touched today. The moments of fear, of laughter, of tears. I'll do it all again tomorrow. Because despite the exhaustion, despite the chaos, despite the endless stress, I can't imagine doing anything else. I arrive home, kick off my shoes, and for the first time all day I breathe. The uniform comes off, and I step into silence. Tomorrow will be waiting, but for now, it's just me. I shower, wash away the hospital smells, and collapse onto my bed. I close my eyes and dream of quiet streets, sunlight, and coffee I can sip without interruption. I fall asleep, knowing the alarm will ring again at 5:15 a.m., and I will answer it, because this is what being a nurse means. And some days, it sucks more than anything else in the world. But some days, it's the only thing that makes sense.